Hello, I am returning a page. Are you the emergency physician?
Yes, I'm Dr. Connor. My first name is Joe, and I'm the attending emergency physician. Who are you?
I am the internal medicine junior resident.
So, should I call you internal medicine or Dr. Junior Resident?
Ah, you want my real name, which is Mark.
Okay, Mark, it is nice to meet you. I have a complicated patient who I think you can help me with.
Can you tell me about the patient?
Certainly. Her name is Mrs. Johnson, and she lives at home with her husband Fred. She is presenting with a worsening of her pre-existing congestive heart failure and renal failure, perhaps exacerbated by an infection. Her past medical history is also notable for diabetes controlled on insulin. She also takes Lasix, Ramipril, Lipitor and aspirin. She has been more unwell for the past 3 days with a cough and typical CHF symptoms. I have done an X-ray which is consistent with CHF, but I cannot rule out a consolidation, so I have started her on an appropriate antibiotic as well as giving her an intravenous dose of Lasix and a nitro patch. Her blood work shows a worsening of her renal failure, and she has a slightly elevated white blood cell count, but her first troponin is not elevated. Her ECG is unremarkable, she is hemodynamically stable, and I have spoken both with her cardiologist and nephrologist, who agree she needs to come into hospital, and will be happy to see her tomorrow morning, to help your team with her management.
Have you ordered a BNP?
No, I spoke with her cardiologist who agrees that a BNP is not helpful when the clinical diagnosis of CHF is clear.
Have you checked her cholesterol, HLA-B27, Cyanca, renine, homocysteine, triglycerides, aldosterone, uric acid or TSH?
No, I have not. But I have assessed the patient for life-threatening conditions and started treatment for her acute and chronic conditions. I have also spoken with her specialists to assure some follow-up while in hospital. I thought maybe your team would assess the patient and consider any further non-emergent testing that she may require.
Have you percussed her chest for tactile fremitus or checked for whispered pectoral?
No, but as I said, I have a chest X-ray which shows some congestion.
Does her JVP have a prominent CLV wave, or does she have a pulsatile liver?
Mark, I don't know if her JVP has a prominent C or V wave, and I'm quite sure you wouldn't know a pulsatile liver edge if it jumped up and bit you in the bum. Mrs. Johnson has worse CHF and renal failure, and 2 of her specialist attendings feel that she could benefit from admission.
Why can't she be admitted to cardiology or nephrology? Or perhaps GI, cardiac surgery, ENT, gynecology, general surgery, plastic surgery, hematology, medical biochemistry, neurosurgery or pathology.
Look, Dr. Junior Resident, by the time you assess her, she may have to be admitted to pathology. This patient is a woman with a complicated history who needs management of a number of issues. That is what internal medicine does. Now, in the time you have spent asking these silly questions, the patient could have been admitted, and you could be back in bed. I have work to do, so I will phone your attending staff to come and admit the patient.
Oh no. Please don't do that. My service will be happy to see the patient. CHF and renal failure, you say? That sounds interesting. I'm sure we will get some great learning points out of the case. Thank you. Do you have any other consults pending for us?
No, Mark, I do not. However, I will make sure the nurses in the emergency department phone you every time your patient coughs or their heart rate changes by more than 3 beats per minute. Thank you for your help.